breaking news on WFLA Now. Here's JB Buno.
The most significant increase in cases yet as Florida's COVID-19 spike continues. More than 109,000 cases since the pandemic began, but now more than 5,500 new positive tests in the last report that just came down moments ago. We're breaking down the numbers here live, everybody, on WFLA Now. Hey there, everybody. JB Buno here with you in our stream center. And these numbers coming in, we've seen 2,000 cases reported in a single day. We've seen 3,000. Most recently, we've seen 4,000. Now here this Wednesday, June 24th, 2020, the 11 a.m. update is in, and we have now eclipsed 5,000, even more than that, 5,500 cases in a single day alone. Governor DeSantis has repeated time and time again over the last couple of weeks that as you do more testing, as you conduct more tests, you're going to see an increase in cases. Meanwhile, there are some studies out there that are suggesting that Florida could be the next epicenter for COVID-19. Not the second wave necessarily, but a resurgence in cases as part of the back end of the curve in the first wave. We're asking you in a WFLA Now interactive poll, what do you think? Who do you believe? Do you believe Governor DeSantis? Do you believe some of the studies, the prominent national studies that have come out that have targeted Florida specifically, pointing to perhaps that the summer increase that we could see could be predominantly here in the state of Florida? We're asking you, everybody, here on WFLA Now in the Facebook Live comment section. But again, reacting to the news here that not only 5,000, but 5,500 cases, 5,508 is the exact number in the last 24 hours. Now, you might remember yesterday, this was from our sister station, WESH in Orlando. Check this out. This is the lines for COVID-19 testing. So when you have Governor DeSantis talking about how there's now an increase in testing happening across the state, including in Orange County, including where he spoke yesterday. Look at the line of cars here. This must be hundreds, if not more than 1,000 cars lined up here in just this one moment in Orange County. This was, again, yesterday, just showing how long this line is. As you do an increase in testing, of course, you're going to see more test results come back and more positive cases. Yes. However, the percent positive is almost 18.5% in the latest report. We are now up to 18% positive and close to 16% positivity overall. Now, to make clear, percent positive is everyone who gets a positive result. That includes people who are being tested for perhaps the second or third time. Percent positivity is for new cases. That's just positive for the first time. So that's why there's a discrepancy there. But overall, 18.5% positive yesterday in COVID-19 testing across the state of Florida. And again, when you see just how long the lines were in Orlando yesterday, and there's a video that we have too from the Tampa Bay area, but this is staggering to see from our sister station, WESH, our NBC station in Orlando, just showing you how long it was, the line here at this particular testing site, this drive-through testing site. And this video, it continues on and on and on, all the way towards the front of the line where you see the drive-through testing actually taking place from this news chopper perspective. So we're asking you here on the WFLA Now interactive poll, everybody, asking, who do you believe? Do you believe what Governor DeSantis is saying, that this is an increase in testing, that this is as we conduct more tests across the state, as Florida continues to look at more results, you're going to get more positive cases? Or do you believe that as a result of we've had protesting, we've had the state reopening, we've had bars that have been packed, we've had reports of restaurants seeing good amount of crowds? What do you believe is the reason as to why we're seeing the increase in numbers here, specifically in the state of Florida? Do you believe it's Governor DeSantis' reasoning that it's an increase in testing, or do you believe that the studies are suggesting that what the studies are suggesting is correct, that Florida could be the next epicenter? We're going to be looking here at your results, everybody, momentarily. I want to see if the actual data surveillance dashboard is up yet and refreshed. Let's see if we can bring this up here, everybody, on your screen. Every day at 11 a.m., these numbers update, and they kind of update in stages. So we're going to see, and I think that they are now starting to fully come in, with the exception of this graph down here in the bottom right that shows resident deaths by day. But here you see the 5,500 cases. So I want everybody here to focus on the upper right-hand portion of your screen, this orange bar graph. In fact, if we can go full screen here, we can get rid of me and we can just take a look at this full screen. So here you can see where we were a month ago. May 25th, 500 new positive tests, and then the following day, less than 500, 476 total. It's kind of hard to see, but if you're following my mouse over here, this is where we were a month ago. And then all of a sudden, we start to see an increase. June 2nd, 1,200 cases. June 6th, 1,400 cases. Then midway through the month of June, June 12th or so, we see 2,300 cases reported in a single day. Then on June 19th, 4,000 cases reported in a single day. And here we are, the record being set here for a single day increase, 5,500 cases. 5,508 is the exact number that we have here in the state of Florida as of the last 24 hours. So we're going to be reading through some of your comments here on Facebook Live. We're also going to be looking at your poll results here momentarily, everybody. As you see here on the left side of your screen, 109,014 overall cases. That's cumulative data since the pandemic began. Of them, 106,000 have been Florida residents. 13,574 hospitalizations, and the death count here in Florida, just in Florida alone, 3,281. I want to point this out here too before we read comments, everybody, with the hashtag KJB. There have been 13,574 hospitalizations since this began. 256 hospitalizations alone on coming in this latest report the last 24 hours. So 256 hospitalizations statewide in Florida in the last report that just came down, pointing to a daily increase of 256 hospitalizations. So Governor DeSantis has mentioned time and time again that he's seeing an increase in testing, a decrease in hospitalizations, but we have to pay very, very close attention to this data and these numbers and these trends over the next couple of weeks, because as we start to see more positive tests, is that going to lead to a parallel increase in hospitalizations? We're going to find out, everybody, in the days and weeks ahead. All right, reading through some of the comments. I apologize. I probably missed a lot of these comments already. Were you using the hashtag HeyJB to read through some of your comments in the Facebook Live comment section? What do you think? Do you believe Governor DeSantis that this is a result of an increase in testing? Or do you believe that Florida is perhaps in trouble? Florida could be the next epicenter, according to some prominent national studies that have singled out Florida, Arizona, and Texas as being some states that are seeing some troublesome trends. Governor DeSantis is saying that this is just an increase in testing, and this is the status quo. This is what we were expecting, is pretty much what he has said over the last couple of weeks. But do you believe him, or do you believe the studies themselves? Let's get to some of the comments. If you use the hashtag HeyJB, that signals to me that you would like for us to read your comment aloud out of the Facebook Live comment section. If you don't want us to read your comment and you just want to comment back and forth with your fellow Facebook Live viewers, feel free to just comment without the hashtag. Let's see. Shannon Tannenbaum, hashtag HeyJB, a WFLA Top Facebook fan. Hashtag HeyJB. It's going to be in another 2 weeks when the young people who are positive infect the older population. The majority of positives is under 30. False sense of security. I'm being passed a note here, everybody. Interesting note that's just coming into our stream center as of moments ago. Governor Andrew Cuomo has just announced, that's the governor of New York, Andrew Cuomo, just announced that New York, New Jersey, and Connecticut are imposing a 14-day quarantine on people traveling in from areas with high COVID-19 rates. Folks, if you were planning on visiting New York to perhaps visit family, or visiting New Jersey or Connecticut, if you're visiting the tri-state area of New York, or upstate New York even, they're imposing a 14-day quarantine on people traveling in from areas with high COVID-19 rates. Okay, what is an area with high COVID-19 rates? He has not specifically said Florida. This is just being passed to me. This is developing news, everybody. So this could complicate travel. We, of course, know about the mandatory quarantine that was instituted by Governor DeSantis for states like New York and New Jersey and Connecticut coming into the state of Florida. Governor Cuomo now, it looks like, is trying to basically return the favor by instituting a mandatory 14-day quarantine on people traveling in from now the areas that have high COVID-19 rates. New York has shown incredible progress over the last couple of weeks, the last month or so, with COVID-19 rates, while other states and other sections of the country, specifically Florida, Arizona, and Texas, have started to see some more alarming numbers. We've also seen the Deep South starting to see some trends that are a bit worrisome. Or is it a result of the increase in testing that we're now starting to see? Is it because we're starting to test more younger people and we're starting to see more positives of asymptomatic cases? Of course, we need a data scientist on to kind of break down these numbers. We need the medical professionals to come down and break down these numbers and look at these latest trends. But again, he has not specifically said Florida yet. He has just said areas with high COVID-19 rates. You would imagine that's likely going to be Florida, but until it's actually put out in an executive order or documentation that states that this is the rules in the state of New York, the state of New Jersey, and the state of Connecticut, all we have right now is that he is putting the 14-day quarantine on people traveling in from areas with high COVID-19 rates. So that's the breaking news there out of New York. Let's get back to some of the comments here on Facebook Live. Gian GG Salgado, hashtag AJB, what exactly is the governor's criteria for shutting down the state again? Governor DeSantis hasn't really entertained the thought of shutting down the state of Florida or reversing course to back to full phase one or back to phase one, the initial phase one that we saw here in the state of Florida. There has been no indication that he wants to trend any backward direction, so there hasn't been much commentary on what that could look like if if Florida starts to go backwards. So to answer that question, we don't really know, because Governor DeSantis is trying to look forward and trying to reopen the state and get Florida's economy back open, back up and running, and back to the way it was pre-pandemic. Kathy McHugh Paris, hashtag AJB, no one is blaming increased COVID-19 rates on protests. We talked about a little bit about that earlier. What could be the reason for this resurgence in Florida? Is it the increase in testing? All the protests that we saw, is that a contributing factor? Is it the state reopening, going from phase one to full phase one? Remember that middle ground between full phase one, or excuse me, the middle ground between phase one and phase two. There was that full phase one that Governor DeSantis instituted. And then phase two, all within a 6 or week so period. Was that too rapid of an opening up process? Could that have been a contributing factor? Are people, does it fall on us? Does it fall on Floridians? Does it fall on folks in Tampa Bay and in Orlando and Miami and elsewhere across the state that we're not taking social distancing guidelines or recommendations seriously enough? Are we not wearing masks enough? Are we not keeping 6 feet away from people enough? Are we not maintaining a group of 10 or less in public situations? Are us flocking to the beaches? Could that have been a contributing factor? These are the questions. And again, we would love to hear from you. If you use the hashtag AJB, we'll be reading through some of the comments, and I'm missing a ton of them here, so I'm going to try to read through as many here as quickly as I can. Walter Pards, hashtag AJB, shut everything down. Lori Dickinson, hashtag AJB, what are the symptoms people are having, mild or severe? If the numbers are high with people having it, but they're not that sick, that makes a big difference, exclamation point. So Lori, and that's what we talk about when we're talking about some cases that trend towards being asymptomatic. And folks that are seeing less severe symptoms, more mild symptoms or no symptoms at all. But as a reminder, you could be asymptomatic and you could give it to somebody, a grandparent, somebody that you meet out and about, somebody that you interact with at the grocery store. You could give it to somebody else who's older, and then they start to show signs of severe symptoms because their immune system isn't as strong as they were when they, obviously when they were younger. We talk about this all the time about compromised immune systems and the elderly population being a little bit more susceptible to COVID-19 symptoms. So as a reminder, when you look at these positive tests, it's not worrisome in that maybe a predominant amount of folks are testing positive that are showing symptoms, but that could be spreading it to folks that haven't contracted COVID-19 yet, that are susceptible to severe symptoms. So just keep that in mind. That's the comment there from Lori with the hashtag HeyJB. Jason Michael, hashtag HeyJB. It's all a contributing factor. All of that are the problem. So that was, I was kind of counting down some of the things, some of the possibilities as to why we're seeing an increase of 5,508 tests in the last 24 hours alone. Susan Logoldice, hashtag HeyJB. Community spread. Wear the masks and social distance. That's the hashtag HeyJB comment from Susan. Nancy Greco, hashtag HeyJB. Florida didn't open in phases. Florida fully reopened back to normal, and that's why the cases skyrocketed. Yeah, you know, so there are some folks out there that believe that while there was a staggered government approach to reopening, Governor DeSantis following the recommendations of President Trump and doing it in a phased-based approach. And Florida's phases look a little bit different than the federal recommendations. Of course, every state's reopening strategy has looked a little bit different compared to their fellow states in that region. But when you look at it, there was a phased approach. Now, that when we went from phase one to full phase one to phase two here in the state of Florida, there's some out there that believe that communicated to folks that, oh, we're okay, we're on the back end of this, everything's going to be fine, fully back to normal. Rather than the government, Florida leadership wanted this done in a staggered approach, but did us as Floridians, did members of the public treat this the way that they ought to in doing it also in a staggered approach? There are people that went from 0 to 100. There was no staggered. It wasn't done in stages. It was, we had the stay-at-home order, and then all of a sudden things are back open and we can go back to our normal lives. And could that be a contributing factor? As Jason Michael commented a short time ago with the hashtag HeyJB, he says that everything is a contributing factor. Everything is being pooled in to the numbers that you're seeing here on your screen, everybody. And again, this is the video yesterday from Orlando. Check this out. We're going to let this play, and you will just get a little bit of an idea as to how many people lined up for testing yesterday in Orlando. It's a lot of cars, and you're going to see it here over the next couple of minutes as this video plays out. Getting back to the comments here in the Facebook Live comment section. Susan Kenny, hashtag HeyJB, refine the tests so that they are more accurate. Carol Cartwright, hashtag HeyJB, everyone needs to wear a mask. We should start seeing a different, I think what you meant, Carol, is we should start seeing a difference. He needs to do what New Jersey and New York did and stop listening to President Trump. That's the comment from Carol Cartwright with the hashtag HeyJB. Hashtag HeyJB from Sue Brinkley. DeSantis messed this up. That's the comment from our WFLA Facebook fan, Sue Brinkley. Again, we're asking you in our poll, and it might have popped up. If you've been watching for more than 5 minutes or so, the interactive poll has likely popped up on your device asking, who do you believe, DeSantis pointing to an increase in testing or the studies that have been done suggesting that Florida could be the next epicenter for COVID-19 over the course of the summer. And we're going to be getting to those results here. If you watch for 5 minutes or so on Facebook Live, specifically on Facebook Live, you'll see that interactive poll pop up, and we'll get to the results here very, very soon. Jill McAllister, hashtag HeyJB. Is any of this caused by protests? So many out there not wearing masks. That's from Jill, a WFLA Top Facebook fan. Hello there to you, Jill. And yeah, that's a question that we will we ever fully understand the answer to? Will there ever be concrete data that suggests whether or not were the protests a major factor in the spread of COVID-19? Were they a minor contributing factor, or were they not a factor really at all? That's a question that I think is going to be combed apart for years and decades by folks in the medical community and by data scientists. Shannon Gillian, hashtag HeyJB. Shannon, a WFLA Top Facebook fan. Hello there to you, Shannon. I've been trying to get a test for over a week now and running into way too much red tape. We've had stories. Masa Saidi, 8 on your side, has been doing stories on folks that have had difficulty getting their tests completed. You can find those stories on WFLA.com and the WFLA app as well. And I watch our 6 o'clock newscasts, look for Masa's reporting, and the rest of our 8 on your side team working on this every single day. Let's see here. Amanda Staffen, hashtag HeyJB. We will be the next epicenter because we are not being productive. That's the comment from Amanda Staffen. Tina Augusto Roisa, hashtag HeyJB. DeSantis doesn't want to close again because he doesn't want to leave the Republican nomination parties. Suggesting that there's politics at play. That's something that folks, I think, really are quick to jump on. That there are folks that believe that the COVID-19 response in multiple states, if not across the country, have been directly tied to politics at play. And that, I think, frustrates a lot of people, that this shouldn't be a political issue. People in the comments saying that this should never fall on political lines when you're talking about saving American lives. That this should be something where we're putting health first, America first, and not parties first, above the lives of Americans. And I think that's what that comment was tied into there. Let's see here. Alexander Apple, hashtag HeyJB. Hey, Buno, that's one traffic jam I don't want to be in. LOL. Imagine if you're sick in this line. Imagine if you're, if you're experiencing symptoms and you're worried if you have COVID-19. Imagine being in this car. If you're feeling sick, you should be at home, right? And you should be in bed. But imagine like being in a car for maybe hours waiting for a test. Sneezing and coughing, if those are the symptoms that you have. Yeah, I think of the people down here in this line yesterday in Orlando. Again, this is from yesterday in Orlando, showing some of the lines for COVID-19 testing. I'm sure that the lines look very similar today. I'm missing so many hashtag HeyJB comments, and I apologize, folks. Sometimes we see so many of them, and I miss so many, so my profound apologies for so many that I've missed. Dorinda Fry, hashtag HeyJB. Dorinda, WFLA top Facebook fan. Hi there to you. Hashtag HeyJB. People are not wearing masks, period. They are tired of this virus, and they don't want to be told to wear it anymore. Life as usual. No matter how bad you want it to go away, wearing a mask is the only way at this point. Wear a mask. In big capital letters is the comment from Dorinda Fry. Lisa Kemmerling DiVenuto, hashtag HeyJB. As a karaoke host, would people be able to take their mask off to sing? Thank you. I would, Lisa, I would just say, and I just one humble opinion, because you're asking, and I would just say that that masks in a karaoke setting right now, I'm thinking of maybe going to a bar or a restaurant where they would have karaoke on a certain night, and I would just disinfect as much as you can. People holding the same microphone and being in the same performance area. Masks are always encouraged. And hopefully if you're singing and if you have a loud enough voice that you're going to come through the mask regardless of, but breathing can be a little bit difficult when you're wearing a mask. So that's just one humble opinion. Katiana Gonzaga, hashtag HeyJB. How much did the Super Bowl add to this spread and never fully peaked in Florida? That's a really interesting question. As a reminder, I was there. Hard Rock Stadium, Miami Gardens, Florida. Super Bowl. Yeah, I was there this past year. It feels like years ago to me now, but I was there, and that was before the pandemic. But that's an interesting point. That was tens of thousands of people filed into one area in close proximity, and there have been reports suggesting that COVID-19 has been around for a far earlier than we originally thought. Could there have been could the Super Bowl have been some kind of a fact? That's a very, very interesting question. When you look at the Florida testing, let's go back here. And you look at Florida cases here, right? The stadium was in Miami. The stadium was right. I'm trying to get my bearings right, but right about here, right there. And this is Miami-Dade. And this has been by far the most prevalent county. 27,000, almost 28,000 cases since the pandemic began. 926 deaths and more than 3,800 hospitalizations there. So when you're looking at Miami-Dade, you're looking at this area as being by far the most prevalent county for COVID-19 cases, and you can think about the Super Bowl being there. I wonder if there's going to be any follow-up, any testing, or any studies rather done to talk about whether or not that was a contributing factor at all. Let's see here. We'll get to our poll results here. We're going to get to 2,000 poll results, and then we'll reveal the results here momentarily. Kathy Murphy, hashtag KJB. Okay, so is this whole COVID-19 thing being inflated? We don't hear daily about the number of deaths and the cases of other diseases. How many deaths in Florida versus other causes? So Kathy, people die on our roads every day. People die from overdoses every day. People die from heart disease every single day. But we have now eclipsed the death count in this country. Everybody, let's see if we can bring up the latest U.S. and world numbers. 121,000 people have died from this since the pandemic began, from more than 2.3 million U.S. cases. Here you see just the graph that's part of the Florida Data and Surveillance Dashboard. And when you're talking about more deaths than some of our world wars, World War I, we're talking about a really extremely troubling trend that's really unprecedented in this country. So I understand that people are dying from other things, and I understand that there are, of course, many factors that lead to people dying in this country. But this is, of course, a major global crisis that medical professionals are working to curb before we start to see this number double, triple, or quadruple. Lisa Catter, hashtag KJB. I really doubt the Super Bowl had an effect. If it were, I would have thought that we would have seen higher numbers earlier on, February and March, not now. And that's an interesting point, Lee. Remember, though, that testing really didn't become prevalent in Florida until later on, when we actually started to get tests closer to February and March. So yeah, the Super Bowl is an interesting thought. Lisa Harris asking a rhetorical question, hashtag KJB. How many people will get sick again or how many people will get sick before we have to shut down again? It's a rhetorical question I've seen asked time and time again. What is the number? What is the number that of daily cases? If the number were 10,000 today, if it were double, if it were 10,000, does that get DeSantis' attention? And start to think about curbing back on some of the reopening? Is it 15,000? Is it 20,000? Or is there not enough? Is he always going to point to the fact that this is a result of the increase in testing? Again, 18.43% positive, and that includes people who have been tested for the second or third time. But 18.43% positive, I believe that is the highest that we have had as far as percent positive in the state. So you're looking at nearly 1 in 5 in this line yesterday in Orlando, perhaps roughly. 1 in 5, maybe 1 in 6, going to get their test and finding out that they are positive. It's a lot. It's a lot. Think about your family. If you have a family of 6, just 1 in 6 is a lot. It's a lot. We're going to another 2 or 3 minutes here on WFLA Now before we have to get going here, everybody. We will have the poll results here in a moment. I'm trying to get to 2,000 poll results. We'll see if we can get there. Or 2,000 poll votes, I should say, rather. Celeste Gorman, hashtag KJB. Yes, people die of other causes, but we've had over 120,000 in a short period of time. People need to remember in only a few months we've had all of these deaths. That's, talking about the conversation that we were just talking about moments ago from the other commenter. Tiffany Rushing, hashtag KGB. What do you think the numbers will go up to when kids go back to school August 10th, expecting to return? School is this, right now, it's this sort of cloud that is hanging over all of this, is it not? There are so many parents out there that are so concerned about school, wanting, in a perfect world, wanting to send their kids back to school. If I've heard from many parents that are getting a little bit restless with having their kids at home all the time and looking forward to being able to send their kids back to school. We read those comments. Some of them are very funny. Some of those comments all the time. But given what's happening right now in the state of Florida, and we've done streams about this, where is your level of concern with sending your child back to school? That's a really important question that's going to be asked time and time again as we get closer to mid-August. As our commenter here, Tiffany Rushing, asking here about how is this going to impact schools. We have many stories on WFLA.com and WFLA's app about the reopening process. And as a reminder, every district has the power and the authority to go about this differently. While schools are going to reopen in August, barring this trend continuing to escalate to a point where Governor DeSantis and Education Commissioner Richard Corcoran are forced to take statewide action, schools are going to open in mid-August. But as a reminder, every district has the power, every district has the authority to institute their own rules and guidelines for the betterment of their students and staff. So really follow your local school districts' policies, announcements, their website, their social media accounts. They are really going about this every single day, looking about this and or figuring out exactly how to go about this come August. And they are trying to do this with your students or your child's health in mind, and the health, of course, considering all the staff members, considering their health, of course, as well. I'm not seeing a couple. Well, Susan Lowe, hashtag KJB, school not safe for teachers or students. That's the comment there. Jonathan Proch, hashtag AJB, there have been 2 cases of healthy teens dying from COVID-19. It took me 2 hours to get through a COVID testing place, for which some of the people weren't wearing masks. Do you think testers are spreading the disease without knowing? Do I think? I trust the medical professionals that are working these drive-through operations like this one here in Orlando that you're seeing on the right side of your screen, that they are making sure that think about it, one individual might work with in an environment like this. One tester might come into contact with hundreds, maybe 1,000 or so people on a daily basis. Maybe not that many. Maybe we'll say hundreds of people. It is so vitally important that one tester is COVID-19 free and is not spreading COVID-19 to people that are coming in just to get tested, right? That's so crucially, vitally important. I trust that our medical professionals here that are in the state of Florida that are working these drive-through sites, they are doing a thorough and elaborate testing process to ensure that their workers on the ground are not COVID-19 positive. But that's an interesting point that you bring up and a conversation starter. And that's why I really appreciate having these Facebook Live conversations, because we get to ask these questions that normally maybe wouldn't get brought up at a press conference. Questions that you are having at your dining room table, and that one that we can kind of more fully explore here. All right, everybody, about 60 seconds away from revealing the results of our poll. Craig Holmes, hashtag AJB, we're all dying of something anyway. No one will ever be 100% safe. We can't stop living our lives. And that's the type of comment that we have seen. And Craig Holmes is not alone with that comment. I have seen that comment so many times again. People saying we're all going to die at some point. No one's ever going to be 100% safe, no matter what we do. There's no 100% degree of certainty that we're going to be able to all stay COVID-19 free. There's always some virus. There's always some illness. That's the comment that I see time and time again. And there are going to be people that are going to feel that way, and there's nothing that I or Governor DeSantis or President Trump or anyone is going to do to change the mind of a person who believes that, well, we're all going to be 6 feet under at some point, and that COVID-19 is just another one of the many dangers that we face on a daily basis. There are people, I have read comments from people. I read thousands of comments on Facebook Live. There are people who believe that if you get into your car, that you're going to get into a car accident, and that's another danger that you face on a daily basis. Now, I think that the numbers would suggest that you have a higher chance of contracting COVID-19 in the state of Florida right now than getting into a car accident, but there are just people who are going to point to, listen, let's get back to, people that are just going to say, listen, we need to get back to our daily routines, back to our lives, back to Florida's economy, trending in the right direction. And we understand that notion and that opinion is out there. And that's what we do here in WFLA Now. We look at all the different opinions from all the different people. This is a place where we can all come together and express our opinions and express our beliefs and talk about both sides of the issue and both sides of how people are feeling about a particular news story. So that's just one that we haven't read in this Facebook live stream, but we have read comments like that in many, many others. People who are asking about masks, we have a lot of resources on where you can get free masks on WFLA.com and the WFLA app. Just head over there and you'll find a lot of resources with how to get masks. Cynthia Lynn, hashtag AJB, did you hear that stores are charging, that some stores are charging a COVID-19 surcharge? I have heard that. I have seen the receipts, but there aren't that many restaurants that are charging a COVID-19 surcharge. That's one of those stories that you see it online and then you think every restaurant is doing it or every bar is doing it, and that's not necessarily the case. All right, everybody, I think we got to get to our poll results here, and yeah, 2,000 results, or no, just under 2,000. All right, so when we started the stream, we talked about how Governor DeSantis has repeatedly stated that this is a result of the increase in testing that Florida is currently experiencing. That this is something that he had talked about in previous press conferences, that as you test more, you're going to get more positive cases. And President Trump, in his recent rallies on Twitter, has said the same exact thing. It is a rinse and repeat sort of go-to, that as you test more, you're going to get more positive cases. And that is very likely true. As you test more, you're going to see more cases. And that's why we look at some deeper data, such as the percent positive and so on and so forth. But who do you believe? Do you believe President Trump and Governor DeSantis that this is all the result of the increase in testing that we are seeing in this country and in the state of Florida? Or do you believe that this is part of an alarming trend? That because us as Floridians, we haven't done a good enough job, or perhaps that if you are of the opinion that Governor DeSantis either closed the state too late or opened too early, or you're of the opinion that we as Floridians haven't done a good enough job at wearing masks in public and at social distancing and at following the rules and recommendations of both the CDC and of Governor DeSantis himself. And do you believe that Florida, as a result of that Florida is going to become the next epicenter for COVID-19? So we asked you in our interactive poll here on WFLA Now on Facebook Live, we asked you, who do you believe, DeSantis or the studies that have come out that suggest that these trends are pointing to Florida being the next epicenter for COVID-19? 28% believe what Governor DeSantis is saying, that it's as a result of an increase in testing. 28%. 72% believe the studies, believe that the data is suggesting that Florida is going to become the next epicenter. So nearly 3/4 of our poll respondents, unscientific poll results here on Facebook Live, but 3/4 roughly of our poll respondents believe that the studies that have come out, several prominent studies that have come out in the last couple of days, that Florida is going to be the next epicenter for COVID-19 and is on its way to becoming the next epicenter, that they believe that is true, that's what the data is proving. Meanwhile, 28%, about more than a quarter of you, believe what Governor DeSantis is saying is true, that this is just a result of the increase in testing that we're seeing here in the state of Florida. That's what we have, everybody, here on WFLA Now. You can read more about this story on WFLA.com and the WFLA app. More stories coming your way, beginning with First at 4 on News Channel 8, 8 on your side, and then watch for our investigations on News Channel 8 at 6 o'clock. That's when you'll see reports from Masa Saidi, the rest of our 8 on your side team. You'll see Steve Andrews, Shannon Benkin, the rest of our really, really hardworking team, Victoria Price, Ryan Hughes, Justin Checker, the rest of our team working really, really diligently hard to get the facts on the very latest here locally for Tampa Bay residents, Tampa Bay viewers, all the way from across the entire region here, everybody. We're talking about different counties across the Tampa Bay area. So I'm JB Buno. Thanks so much for being with us here on WFLA Now. Hop over to WFLA's app or WFLA.com for the very latest on today's stories regarding COVID-19 here in the state of Florida. We'll be back.